My name is Melissa Richards, and I am an obstetrician gynecologist at Olmsted Medical Center. As an obstetrician gynecologist, I take care of patients throughout their lifetime. So I take care of patients who are in the process of pregnancy, as well as patients who are done having babies, or maybe they're thinking about having babies. It really is a full spectrum practice, and I get to take care of them throughout their entire lifetime. I became an obstetrician gynecologist for a couple of reasons. When I started medical school, it wasn't the path that I thought I was going to be on. But as I started to do a couple rotations and got to see the variety of being an obstetrician gynecologist, that means I get to be in the clinic setting, I get to be doing surgery, and I get to help during a really special time in a lot of patients' lives when it's time to have a baby. So I really love the variety pack of being an OBGYN. For me, one of the most important things for patients to know when they come to see me is they're not in charge of making me feel comfortable. My job, part of my job, is making sure that the patients that I'm seeing feel comfortable. So letting that go away, I'm here to help and assist and make a plan. I think to me, that's really important. We put a lot of pressure on ourselves to make everyone in the room comfortable. And that's not your job when you come to see me. That's my job. Being a gynecologist, it's kind of like being a problem solver. What's really interesting about my job is everyone's problem is a little bit different, which means the solution is a little bit different for everyone. And what people feel comfortable may be different depending on who the person is. So what I enjoy most about my job is I get to find the perfect solution, or the solution that makes most sense for each of my patients. Some of the solutions that I have within my practice include surgical procedures. These are procedures that can be done in the office setting or done in the operating room. It depends on the patient. I really enjoy helping my patients manage abnormal uterine bleeding. It's an area of, I would like to say, expertise for me. I think I do that very well. Some of the common procedures that I do in the office setting for abnormal uterine bleeding include a procedure called a hysteroscopy, where I look inside the uterus and I'm able to remove anything that might be causing issues with bleeding. I'm also able to do procedures in the office that can help reduce the bleeding. So not only identify what is causing the bleeding, but also treat that issue. I also do procedures in the operating room, including a hysterectomy, which is removal of the uterus. And the nice thing about these procedures is we oftentimes are finding the most minimally invasive way to get the outcome that everyone is looking for. As an obstetrician gynecologist, I understand that coming to visit me oftentimes isn't, let's just put it, not the most exciting place to be on any given day. So the importance of being able to feel that connection and feeling like you're being trusted, that you feel safe, that there's no shame when you come into my office is vitally important for me to be able to provide the care that any of my patients need. So connection for me is probably one of the most highest things on my list for priority when it comes to working with patients. And it's something I take a lot of pride in. When I'm not being an obstetrician gynecologist, I'm at home, and home for me is living in Winona, Minnesota. We really enjoy being outside in the outdoors, and there are lots of trails. We do fishing. We spend time with our animals. I've got a great family and a great group of friends that really support me and give me some time to blow off steam when I'm not being an OBGYN here at Olmsted Medical Center. There are so many reasons why I come to work every day. I have the best colleagues. My patients are amazing. And at the end of the day, I'm tired, but I know I've done something really good for my community and the people around me.